So we're gonna go into a little question and answer period, and we're gonna open things up in a moment for folks that are looking to ask questions. We're gonna open up live, so folks can raise their hand in a moment, and we will try to call on folks. If folks want to not do that and want to ask in the Q&A, that's fine as well in the chat. But if folks want to pop in, that's also fine. So you guys have all done some awesome work, and we see some definite common themes. One of the things I wanted to touch on, two things that I want to ask, and then we'll open things up. One is that, I think we've all seen the issue of there are a lot of really good things happening, and we're all trying to figure out what fits best and what can be brought to scale, because let's face it, it's great to see something done in like a zone or done in one city. And how do we bring that to scale? One of the hardest things is to bring something in a city 24 hours a day, 7 days a week. So that way we have right coverage, right? We talk about like mental health response, like look at that and think about trying to cover 24 hours a day, 7 days a week of making sure you have that alternative response. That's a really difficult ask. And it's also really difficult because there's, of course, politics. Michelle, I think you brought in the whole kind of the little political atmosphere. I've lived in a political atmosphere for a while. Actually, I don't live in the political atmosphere anymore. I used to live in it. So if you guys could just, folks, if they want to just touch on this, like what have you guys seen so far in your experience, either in this or in other experiences? Where does that political atmosphere fall in the research you guys have been able to do for long-term versus short-term? Like if we're trying to get initiatives that start out and do really well, how do we bring them from being a short-term project with somebody's name being like, I brought this here, to like a long-term solution? So folks, that collaboration, right? That how do we make it a collaborative approach so nobody can be like when they come in, I'm going to do away with that because my name wasn't on that. That was the other person that I ran against and I just beat. What are your guys' thoughts? And folks can just unmute themselves and just jump in if you don't mind. You guys can all do that. Go ahead, Michelle.
I'll come in there, and I think it's I've had experience of working in a police force, in a public health institution, and then in academia as well. And what I can certainly say from those experiences, and obviously delving into the projects that we have done so far, is this will never change unless we change the red, amber, greens that we have within these institutions themselves. So there's got to be the challenge, but that challenge is going to come from the ground a lot of the time. So what we need to be considering, and certainly conversations that we've been having, is how do we incentivize people to not be promoted, or because that's what you hear about. When I was in a police force, you'd very much hear about, well, actually, I'm going to drive, exactly what you said, Brendan, I'm going to drive this initiative because it doesn't matter if I don't see it through, I'm driving something and it's going to get me the promotion that I need to go to the next step. And when it comes to funding, again, just kind of pushing back, which we certainly did in public health, to government to say some of these indicators are not showing truly what we're doing, and pushing back on that on the ground, rather than looking at reduction of violence incidents, knife crimes. Actually, we got to learn and got to push back on some of this and the misunderstanding. And taking a really basic example, which is some initiative that we've looked at in our project around co-responders of domestic abuse, with an independent domestic abuse advocate that works for our health service. Now, what you might see is an increase of domestic abuse calls come in. That doesn't necessarily mean that that's a bad thing. That might be actually increasing confidence in that community, might be increasing that victim to come forward more. Actually, as a measurement back to government, that might look really bad. So it's about really, truly understanding and picking some of that, which has to happen within these organisations, and from the evaluators themselves, which again comes back to evaluations being multidisciplined in themselves too. Don't just have criminal justice researchers, have public health institute researchers, have criminal justice researchers collectively working together and pushing back on that evidence.
I'll hop in here as well. Just hugely echo everything that Michelle just said, particularly around multidisciplinary evaluations to show program impact. And also, I think the source of the interest in these interventions is really important. I think you want them to come from the community, right? Especially here in the US, we've got such frequent political turnover. The average tenure of a police chief is a few years long. We should be implementing the programs that communities are advocating for, and then they'll sustain any type of change in leadership from the top, because if somebody wants to get elected, they need to reflect the will of the community. But what that means is that it's incumbent on us to educate and empower communities about their options so that they can advocate for something that's actually based in evidence.
I think we don't hear you, Brendan.
Thanks, Jaime. I forget about mute. So from an ex-police police chief's perspective, you know, it is difficult because, you know, you only have a certain amount of time, and you deal with a couple of different pressures. You know, I used to tell folks that, at least I think I mentored, that when they take that job, they have to be ready to just lay their badge down and walk away if it gets to that point where what they're trying to institute for the right way, those pressures come to the point where it's about to go against what they believe, number one. And then number two, you know, I think the biggest pressure when we talk about reforms sometimes comes down to the budget. You know, this is a conversation we have a lot around changing policing and stopping arresting people, because of course that means budgetary assets are going to go down, and the recognition that, like, we're not supposed to use the criminal justice system to feed the budget. That's not the appropriate use. So I certainly remember some conversations about, well, you know, fines have gone down. It's like, well, yes, that's because we're not going to arrest and ticket as many people. That was the plan moving forward. So absolutely. I mean, I didn't know, besides making sure I could be heard, did you have something you wanted to say there besides correcting me? Thank you.
No, I think that I echo what the two of them said. I think one important part is, how do we institutionalize the projects beyond the personalities who created them, right? I think we tend to forget sometimes that people are there momentarily, but institutions last longer. So I always make the emphasis, also coming from this triage perspective of being in academia, activists, and government job, that, you know, we need to sign agreements between institutions rather than just the people that represents the institutions. Because if people changes, then at least between the institution, there can still be written memory that there was some collaboration there. And for the next team that comes in, there's something that they can build upon, right? And sometimes I think we're trying to forget that. And many of these things ended up just being there because some people decided to make it their personal project, but then when they're gone, everything dies, right? So what can we sustain these things more collaborative? We'll have some written agreements about what the objectives are, how we got to evaluate it, and well, with the impacts that we have in our community. So then the next policymaker that arrives has some context and cannot walk away that easy from those commitments.
Yeah, you're saying community, and I know Mo brought up community. I think community is definitely the key, because communities, when they drive things don't go away based on who is sitting in what chair. So it's a great point. All right, awesome. So I just want to turn to one other thing before we open things up, and that's, you know, one of the things I was pleasantly surprised in, and I've had the pleasure of sitting in on some of the calls with Mo on the North America stuff, is some of the other things that maybe we weren't thinking of when we first started this, of things that folks have found out that people want to be interested in, that will take us down a different road. And one of those is, you know, we've talked about response to mental health calls across the globe, but one of the things we heard was also about, well, what about the folks that are doing that response? What about the police? And then we got in a really good conversation about, let's talk about the police and the social workers. Like, if we're going to bring a whole nother group of folks in that are going to be the primary responders, like, what do we do to make sure they're okay? What do we do to make sure that, you know, I have no problem. I tell people all the time, I lost empathy at one point in my career. And when you lose empathy, if you're going to go on a mental health call, there might be a problem there. So, you know, Mo, do you mind just kind of touching on how that conversation went? And then folks in the other regions, like, what have you guys found that have been kind of those pleasant surprises that have popped in your conversations around this work?
Yeah, I mean, the conversation went in a really interesting direction that, I'll be honest, I didn't anticipate. But, you know, we sort of falsely siphoned off practitioners and responders as if they aren't part of a community. And when you're looking at sort of public health interventions, it's really important to look at the interventions that support their wellness as well. There's research here about how there's a really shared exposure to trauma. So a lot of the trauma sources in a community are the same trauma sources for law enforcement and first responders. So a lot of the interventions we're talking about for communities could also be helpful for the first responders that support them. But we just need increased attention. And we're actually currently in the process of compiling a lot of different innovative ways that jurisdictions are supporting their first responders. It's a complicated discussion, right? Because here in the US, especially, there's a real shift or there's a real push to shift resources away from police departments. But if part of what we're arguing is they need better mental health support in order to navigate the trauma that they're exposed to, that is a resource requirement. So it's complicated, but we're certainly paying attention to it. One thing I think is really important is just the acknowledgement that it is likely that as a first responder, you will be exposed to trauma. Right now in the US, a lot of departments tend to put the mental health intervention after somebody's been exposed to trauma. And at that point, it's almost too late because the resilience hasn't built up. So really changing it so that it's part of just a basic training to have that profession so that you actually understand how to build resilience before you're exposed to that triggering factor. It's a great question.
Moon, I know you had your hand up, I believe, so I want to make sure I get you.
Yes, I wanted to comment on the issues of sustainability as it relates to collaborations. And I've seen that in most cases around Africa, it has been very problematic or challenging, especially for civil society organizations to form partnerships with law enforcement agents. And what I've seen to work in some countries is when the law enforcement agencies make it their, part of their performance systems, whatever they want to achieve, whether it's health outcomes. I think if it becomes part of their performance system, I think it works to be better, that they are kind of either forced to implement certain projects and programs that relates to, increasing either knowledge or changing attitudes or practices of the police officers. For example, with the South African Police Service, there is a program that they're implementing that relates to, sex work, drug use, and people use on LGBTI. In most cases, these issues, they always say, they are not their mandate, but when you make sure that it's part of their performance system, they report on a yearly basis to it, it actually becomes better and it adds to sustainability that in the long term, they always implement those programs and so on. Thank you.